So thanks very much for inviting me to this exciting discussion, conference, dialogue on the HIV epidemic. I'm going to take you through a set of slides here. It's not very interactive, but I hope that at the end of the presentation, I can provide you with some resources that you all can use. Next slide, go ahead. And just to say, my name's Mahy, and I'm the lead of the epidemiology team here at UNAIDS. First of all, I'm just going to talk from the very high level, from the global level, only because we have a limited amount of time. But I hope that you all recognize that this is just a summary of where we're at and shouldn't reflect the lack of data. We do have other data that goes down to much lower levels that would help you see the situation kind of in countries and regions and districts and in facilities as well. So starting with the sad news, I think the important thing to really recognize is this fight against HIV is not over yet. We still had almost 700 AIDS-related deaths in 2019. As you can see from that curve in front of you, the number of deaths has gone down over time considerably since the peak in 2005, but we still didn't make our 2020 target of having less than 500,000 AIDS deaths in 2020. If we look at that in the graph on the right-hand side, it's looking at males and females. And so the blue is males and the more reddish color is females. And you can see that deaths remain high among men. They're not having that same drop that we're seeing among women. Next slide. And the cause of this is because of the major difference we're seeing in treatment coverage among men and women. And women in almost all regions except for Western Europe and North America have higher treatment coverage. Again, that's women have higher treatment coverage than men. A lot of that will be due to women being tested more often because of antenatal clinic care. But it's an important gap and one that we need to close to make sure that we don't leave men behind. Next slide. We do see a lot of successes though. And so as you're all aware of, there's these 90-90-90 targets, which is really making sure that people know their status, that they're on treatment, and that they have suppressed viral load. We've seen this in a wide variety of, well, first of all, globally, we've seen that, sorry, back one slide. Thanks. We've seen that about 81% of people living with HIV know their status. So that's a nice high level. Kind of 1 in 4 still, or 1 in 5 still needing to know what their status is. About 2/3 of people who are living with HIV are on treatment, and about 59% of those people living with HIV have a suppressed viral load. If we multiply the 90-90-90 together, the goal is to really make sure that 73% of people living with HIV have suppressed viral loads. And that far right-hand list over there, and apologies for the small font here, shows the real diversity in countries, sorry, back to the next slide. The real diversity in countries there that have achieved that 73% proportion of the population living with HIV with suppressed viral load. Countries such as Botswana, Rwanda, Uganda, Zambia, Zimbabwe have achieved that. So very kind of lower resource countries have that. Well, we see the expected Australia, Netherlands, kind of wealthier countries that have also achieved it. So the point is to say that, you know, countries can achieve these targets. They're not impossible. It's just a matter of providing them the right support and the right focus to make sure that they're able to achieve those goals. Next slide. So that's great for some countries. And you can see here, Eastern Southern Africa, there's quite a few countries where that kind of that teal color, which is looking at the top of the treatment cascade, has reached quite high levels. And the gold part of the bar is saying how many people know their status. The blue is people who don't know their status, or sorry, know their status but aren't on treatment. And the green is people who are on treatment that aren't virally suppressed. And so that gap in what we need to close is that gray part of the bar. And you can see Eastern Southern Africa, the countries have really done quite well, except for a few that are lagging behind: Angola, Madagascar, South Sudan, to name a few. But what's important to note is that within these countries, there's very big diversity. And so while women in Zimbabwe are doing quite well, if we look at transgender women in Zimbabwe, specifically in Harare, you see the gap to the proportion of women who know their status is a huge difference. Only 36% of women, transgender women, are aware of their status. So that whole cascade is then much lower as a result. So these incredible gains that we've made in some countries really hide what's happening among key populations, and we need to keep our eye on that. Next slide. The other group that's not faring so well is children, and I understand that's a population very important to this group, and I agree completely with that. You can see here the darker green bars are the adult coverage. That's the proportion of adults receiving treatment. The lighter green colors is the situation with children, and you can see a large number of children well below the adults, especially in countries in West and Central Africa. Now we know that it's quite easy in those countries to try to reach the adults and try to get them to bring in those children for potential testing to try to get them on treatment. There's all sorts of initiatives that need to happen to make sure that the children don't drop off of that treatment because of poor regimens or inability to get to services, inability of their parents to get to services, etc. So there's stuff we know to do, but we haven't done it yet. And so there's a critical gap to close for the children. Currently, we have globally 53% of children living with HIV who are on treatment, while that value for adults was 67%. So an important gap there. Next slide. Now moving on to kind of the new infections. So we know that treatment will help bring this number of new infections down, but more importantly, we need to get that combination prevention efforts out there to really slow down new infections. That graph that you see in front of you is the global number, and you can see how far away we are from that target of 500,000 new infections by 2020, more than double what we had intended to reach at this point. Next slide. If we take that distribution of new infections globally and we look at where are these new infections coming from, we see that 62% are in key populations, and we really need to make sure that when we're focusing our efforts to reach out to community to provide services for people who are at risk for HIV, that we're reaching those key populations. Next slide. Sorry, next slide, but hit enter. Thanks, Mahesh. We can also break down those new infections by sex and age, and it really quickly shows us where our gaps are. For example, in sub-Saharan Africa, we can see that females 15 to 24 are 24% of the new HIV infections. And in the population is only 10%. So huge discordance there between the proportion of new infections and the overall population. If you hit enter again. And one more time. If we go outside of sub-Saharan Africa, it's a very different story though. If you look at the males, 25 to 49, 48% of the new infections are in that age group versus 18% of the total population. So again, a huge discordancy outside of sub-Saharan Africa, focusing on those men 25 to 49 versus in sub-Saharan Africa where we're focusing on women, and particularly women 15 to 24. Next slide. Go ahead, yeah, thanks. So one of the things that we just know is important for UNAIDS and partners to really focus on is making sure our laws and policies do not further the marginalization of stigma and discrimination and other barriers to getting treatment and prevention services. This graph comes from our National Composite Policy Index and looks at the fact that how many countries are criminalizing key areas that will allow us to reach key populations, starting with the far right-hand side, the criminalization of same-sex sexual relations, where 69 out of 194 countries currently criminalize same-sex relations. Similarly, with criminalization of HIV transmission, where 92 out of 151 countries criminalize that. So an important piece that we can look at to try to change the situation in countries and make sure those barriers are removed. Next slide. Focusing a little bit more on adolescent girls and young women, as I mentioned before, it's such an important population for preventing new infections in sub-Saharan Africa. This map shows our data by district, showing where the hotspots are, where do we need to really focus in our efforts to reach those adolescent girls and young women and make sure that they are empowered to protect themselves. Next slide. And just going back to children, I think the other thing that's really important about children is trying to understand what's happening with new infections. And we have this measure of PMT-CT coverage, and you can see in those green bars that we've done quite well with reaching women who are living with HIV who are pregnant. We have, I think it's 86% of women are on treatment, or are receiving treatment when they're pregnant. However, you can see the black bar, or the black line, excuse me, is the number of new child infections and how that's flattening out. And there's important reasons for that. If we go on to the next slide, we can do an analysis that allows us to kind of model what we think is going on based on data from countries. And we see that globally, the vast majority of new infections are because a mother received no ART during pregnancy. And that's the gold bar in this lineup. If we look at the Eastern and Southern Africa, looking at the new child infections based on cause of why it might happen, we see that orange bar, which says that 23,000 new child infections are due to mothers who became incident infected with HIV during pregnancy or breastfeeding. So we know we need to get there and protect those women during that kind of sensitive time when they might be becoming infected and also passing it on to their children. Then we look at Western and Central Africa, and we can see the vast majority there of new infections is because of women who never received any treatment at all. So we know what to do. We just need to do it in the right countries and in the right programs. So next slide. These last two slides, I'll just go through quickly. I think in 2016, we set targets to try to really understand where were we going to go and what were the efforts that we needed to do to reduce new infections globally. And we missed those targets. We missed a lot of the interventions that we were expected to do. As a result, we have 3.5 million more new infections between 2015 and 2020 than had we reached those targets, just showing the real importance of focusing our efforts and getting there. Next slide. Similarly, had we reached the treatment and testing targets that we had initially predicted, we would have had 820,000 more, or 820,000 fewer deaths between 2015 and 2020 had we achieved those objectives. So that's the cost of not focusing our efforts enough in the last 5 years. And the final slide, actually final but one, what are the resources that are going into the AIDS gap? And you can see there we had a target of getting to $26 billion by 2020. We've only reached just below 18 billion. So we had some major gaps, and we can see that those gaps are due to changes that are going on in some of our bilateral financing. There's also stagnation though across the board in the domestic funding, as well as some of the other international funding. So really getting that motivation back of our donors, as well as countries to focus those investments in efforts that can really slow the epidemic is important. My last slide is probably my most important slide. I've heard a number of times in the past few weeks that civil society and others don't have access to the data that UNAIDS relies on and countries rely on to understand their response. Here's a set of sites that you can visit, and don't hesitate to write to any of us at UNAIDS, email us, and we're happy to work with you to make sure you've got the data you need to make your response as focused and appropriate as possible. So that's it from me. Thanks.